it's clear that African Americans in San Francisco are suffering from historic trauma. And we have been going around with the Commission this past year, sort of talking in different neighborhoods in San Francisco, hearing from the people what it is they need. And we had decided to focus on traumatic stress. And basically, people might have heard the concept of post-traumatic slave syndrome. And the reason we haven't used, or post-traumatic stress syndrome, and the reason we haven't used that term is because it generally applies to veterans in many ways, and it also implies that the trauma is in the past. And people in our communities have suffered past trauma, but the trauma continues daily with domestic violence, with gang violence, with poverty, with a whole host of things that predispose Black people in San Francisco to traumatic stress. And the thing about it also is that the symptoms of traumatic stress, which can be profoundly, which can profoundly impact our day-to-day functioning, quite often are very, very subtle. And I just want to list some of them here. Flashbacks, reliving of the traumatic event, which seems obvious, but feelings of shame and guilt, feelings of emotional numbness, difficulty getting to sleep, nightmares, trying to avoid thinking about the trauma, irritability, anger, anxiety, easily startled or frightened, anxiety, hopelessness, difficulty concentrating, loss of interest in activities previously enjoyed, avoiding places, activities, or people that were associated with the traumatic event. Not only are African Americans overrepresented, the diseases caused by traumatic stress, they're severely underrepresented in the mental health system. African Americans do not tend to seek mental health treatment. When they do, they're quite often brought there involuntarily by the police. They end up in the emergency rooms. They're overrepresented in the emergency rooms. They're way, way, way overrepresented in inpatient psychiatric hospitals, in locked settings, and tremendously overrepresented in the prison system. And this is just not the way we can continue to go forward when it comes to treating mental health of African Americans in San Francisco. So we worked to come up with some policy recommendations, and Makula Godwin is going to talk more about those.
Some of our recommendations, starting with Dr. Hall's presentation of educating our communities as to how we got to where we are, is that we develop guidelines that would include establishing a facility in our communities that addresses symptoms and treatment of traumatic stress among individuals and families. Now, Dr. Hall has already mentioned that we often don't know that we are suffering from post-traumatic stress syndrome. So beginning today, people should recognize some of these symptoms, that we first ourselves become educated in this room so that we can continue to spread the word, as we say, to increase this educational process. With programs and services offered and developed at this facility, free to the community members or based on a sliding scale. City and public health clinics and San Francisco General conduct routine screenings with instruments specifically designed that for identifying those symptoms of traumatic stress among our African American clients and patients seeking services. City public health clinics should establish data surveillance systems aimed at monitoring the prevalence of traumatic stress. Further, these data should be made available to the community and be used to inform the development of interventions and services aimed at the prevention and treatment of traumatic stress. And improved outreach efforts aimed at increasing awareness, which probably should be at the beginning of this list, about the symptoms of traumatic stress and its impacts on individuals, families, and the community. Making resources available and eliminating stigma related to traumatic stress. So this is a start, and this is something that should require a lot of work. In developing these instruments, we want to collect data.
You know, our biggest policy recommendation is actually to develop a center. And one of the reasons even though that's big, and it's going to be an expensive thing, maybe we can even use the day at the Southeast Community Mental Health Center, Southeast Center, when it's closed. But the point is that African Americans do not voluntarily go to the mental health system as it's set up right now. And there's a tremendous amount of data that suggests that if you put family and community centers in African American neighborhoods, however, you're much more likely to get the African Americans that you're trying to target to actually come in and seek help and seek resources. So we have at this point an already overburdened community mental health system that is overburdened dealing with the chronically, persistently medically ill that have already been identified in San Francisco. And if we're going to impact traumatic stress in our communities, we cannot leave that to the currently overburdened community mental health systems.